setting there. And that's how you're going to return that cycle that you're going to want to see.
That's great. So and you brought up a really interesting point in the gym setting. You could set it up with a lounger, put it, over to the side of the gym, maybe have a couple of them. You don't need necessarily medical oversight to implement. You can have
Correct.
it within a gym environment, train, maybe have one of their or multiple other people who have that certification. So in the gym, it's more official, and that's it, right? There's nothing additional. So it can be implemented without the medical supervision. Is that true?
Yeah, it's very true. That's a good point. We actually are working with a couple of groups right now that have a gym setting where they're adding in like, a 2,000 square foot or more
Mhm.
wellness center that is an upsell for them for like an elite
Wow.
package where they're adding on to their membership where traditionally maybe it's $79 a month. Now they're going to charge 99 or maybe $119, but that gives you access to the wellness center and you can easily implement a PEMF in that operation.
Yeah, that's awesome. I like that. Now, overall, everything that we've been talking about today, recovery, many times a missing pillar in a lot of these practices. And you'd mentioned they're missing out, not just missing the modality, but people are going to bypass their practice and go someplace else. That's a lost patient. Definitely optimizing recovery. We want to be able to optimize performance, gym environment, help them optimize their performance, optimize their recovery. Now, here's the good part. Um, Most patients aren't coming in to pay for treatments. They want to pay for outcomes and they want to pay for the overall experience. And let's
Correct.
talk a little bit about that. How much of the when from a clinic perspective, and this is really a sales perspective, because we get into some of these medical environments and the provider staff, they don't really know how to sell a very important treatment. I look at it as a non-negotiable. It's not optional. Here's what we think is going to be your best outcome. But how much of this is then focused on the clinical versus the overall client experience and outcome?